Wow. So I just want to kind of dig on that a little bit more. So you're saying if, and maybe, and please correct me if I'm wrong, I'm looking just so that I can kind of, formulate it in my head. If you ran across a nurse that was quote unquote suffering from, burnout, it wasn't necessarily because of her job as a nurse, but maybe that contributed to it. But the root cause was some sort of trauma or neglect or abuse that he or she may have experienced in the years past, and then it contributed to her being more susceptible or he being more susceptible to having burnout.
Well, that sort of. So when we look at occupational related trauma,
Mhm.
you know, those of us who are healthcare providers, and that would include our home health professionals, right? We go out and we have a high degree of trauma exposure that is occupational related.
Sure.
Now, part of that we get training for, right? We get training for the secondary or the vicarious trauma. We as healers and health professionals, we suffer to some degree along with those in our care, and we've received some training in how to navigate that. We also receive some training as regarding what to do if we have a national disaster, a flood or a major earthquake. So as health professionals, we all get some sort of training and preparation for how to manage that type of trauma exposure. But what is really happening is that we have a lot of occupational related system and or organizational related, the short staffing, the violence, the other factors. So that's like on the occupational side of things, and that is what's um, tilting the scales. But to your point, to your very good point, is that each of us, so if you start looking at the research, which of course is, what I do for a living, right? And so if you start looking at the research, and I went to the American Association of College of Nursing, and they put out the guidelines for every nursing program in the United States. All right. Every single nursing program, you are with the AACN as the acronym. And so I went and looked at what is their position statement? Like how are they saying that we as nurses and health professionals should be approaching this trauma phenomenon? Because as you rightfully stated, so many people have experienced some sort of traumatic event in their it's part of the human experience, quite frankly. And so how does that affect what we're seeing in the burnout, which is oftentimes trauma? And so I went to the AAC and I started deep diving, and their position statement is that we as healthcare professionals, we should assume that every person on this planet has had some sort of trauma, right? That they have experienced that. Now, it's not our job to uncover it.
Sure.
It's not our job to relive it. We don't need to know what it is. We just need to take that approach. And so that got me really thinking, like, okay, but aren't healthcare professionals and nurses, aren't we a subset of the everyone?
Right.
And indeed we are.
Sure.
And so that sort of started me on this whole rabbit hole, if you will, of really looking at, so how does trauma work? How does what maybe experienced in my life and you've experienced in yours, and everyone in our audience today has experienced something. How does that work? What happens in the body, and how does that translate to how it is expressed or experienced in the workplace? And so that was a 5-year question.